Vanakkam. Any young surgeon will face this dilemma in his or her life at some point of time, either at the time of passing out on getting their degree or early in their career. That is, whether to pursue an academic career in their specialty or go ahead with private practice. Nowadays, the boundaries, the line between these two different types of practice are becoming more blurred, and a lot of academic work is done by private practitioners too. Though research and publications can be done by surgeons in private practice, I am talking about an academic career where it is part and parcel of the service. Both these streams, that is, an academic career and a private practice, have their own merits and disadvantages. In this video, I shall talk about the academic career in particular and to a certain extent help you decide whether you are suited for an academic career, whether you have an aptitude for a career in academics, and if you are interested and inclined to that sort of work, how to achieve it. Before we learn about the features of an academic career, let us first see what an academic career is. It mainly refers to practicing in a teaching institution or medical university. Nowadays, even private institutions and corporate hospitals have teaching posts which can be considered as academic posts. In these sort of institutions, your role will primarily be for patient care and clinical practice, teaching medical students and residents, conducting research and publications which may be mandatory in some institutions, and finally, academic leadership and mentorship. If you get the opportunity to work in such an institution, the biggest advantage would be intellectual fulfillment and continuous learning because you're going to continuously treat patients and keep learning from them. Apart from that, since you're going to be involved in teaching students, you will also have to remain updated with the skills available. There will also be an opportunity to innovate and influence the future of the specialty. This kind of post will ensure a stable income. This was very obvious during the COVID period when people working in such institutions could maintain their income, as opposed to private practice physicians who found a dip in their income. As you go ahead with publications and presentations at conferences, professional recognition, you will get professional recognition. And teaching students over years will lead to long term mentorship relationships. But of course, there may be some disadvantages because you will have some administrative workload and bureaucracy may be there. Balancing clinical, teaching, and research duties, which are all part of your work, may be a little difficult in the beginning. Though the income will be stable, there will be a limited early financial rewards compared to private practice. Having seen thus far, let us consider an hypothetical situation. You are getting an offer from a recognized medical college in your city asking for a senior registrar in plastic surgery, and at the same time, you're getting another offer from a swanky corporate hospital asking for a consultant in plastic surgery. Which would you choose? If you have not decided and this is your reaction, I am here to help you. I'll just ask a few questions and then we'll get going. What actually energizes you? I mean to say, after a long day of work, what part makes you feel alive rather than exhausted? Is it teaching juniors, discussing anatomy or techniques, designing studies, or presenting in meetings? Or is it independent surgery, patient gratitude, and quick results that makes you feel invigorated? Secondly, are you curious? Do you find yourself asking, why did this flap fail? Or how could I modify this design for better outcomes? And actually want to explore it through data or literature. After a particularly tough and challenging case, if you instinctively search PubMed, you're likely to be academically curious. And what do you feel about learning and teaching? Do you enjoy discussions, presentations, and teaching? And do you find happiness in explaining concepts to juniors and making it simple for them to understand? Are you interested in research and innovation? To be interested, you don't need to love statistics, but you should enjoy asking structured questions and finding evidence based answers. That is enough to qualify you as interested in research and innovation. And if you love seeing your work published or presented and think of improvements for your next study, that is a strong academic signal. After all the work that you do, what sort of feedback do you relish? Is it a patient smile or a peer applauding your presentation in a conference? Both are valid actually, but if the second, that is the peer applauding your presentation, feels more deeply satisfying, academia might be your natural home. And finally, do you have mentorship moments? That is, when you meet faculty or visiting professors who are academic leaders, do you feel inspired and curious about their career path? Or respectful but uninterested in their research life? Putting all these answers together is a sort of self analysis. You are a person who is interested in academic work if you enjoy teaching, reading, and writing about your field. If you ask why and how questions after every case that is done, if you feel drawn to innovation and structured thinking, you value intellectual contribution over immediate gain. And most importantly, you have patience and persistence. You are academically oriented. You need to take up a job where there is a lot of academic activity going on. Okay, so now we have found out that you are academically inclined. What next? What should you do to develop this interest that you have, and how to aim for what is known as academic heaven? I'll tell you the 7 steps to academic heaven and to achieve your goals and satisfaction in this endeavor. Step number 1: excel in your MCH or DRNB training. Academic excellence begins with mastery of plastic surgery principles. Read one major textbook. It could be Nelligan or Graben Smith or even the Indian Plastic Surgery book compiled by Dr. Karun Agrawal. Regularly follow journals like IJPS, PRS, and JPRAS. Maintain a small personal digital notebook. Today's notes become tomorrow's lectures and publications, and you are academically oriented. You will have a lot of academic activity later on, and all these notes will come in handy. The second step is to get involved in research early. Just start with case reports or case series. These are easy, but at the same time, they are clinically relevant. Learn basic research design and biostatistics, example through the ICMR or NPTEL or the Coursera. Attend state and national conferences like the APSICON, your respective state conferences, and CMEs that are being conducted in your area, and present posters or papers. It gives you a rich experience. Ultimately, doing all this builds your CV, your confidence, and your connections, which are going to play a big role in your future life and career. Third, develop teaching skills. Academic surgeons are great communicators. Teach your juniors, undergraduates, or interns. And if they are not there, teach the staff nurse, teach the OT technicians. They are never going to say no if you're going to teach them. They feel important, and you are also able to recruit the knowledge that you have gained by talking to them and teaching them. Observe how your professors teach. Adopt what resonates with you, what vibes with you. Eventually, you'll be mentoring residents or students yourself, even though you may be a resident or a young plastic surgeon. Teaching is the best form of learning. Then you have to seek mentorship and collaborations. Find at least two mentors: a clinical mentor who shapes your surgical skill and judgment, and an academic mentor who guides your research, writing, and presentations. Both may be the same person, but seek out the best person for this. Use technology and artificial intelligence smartly. Use Zotero, Mendeley for reference management. AI tools like ChatGPT can help with drafting, summarizing, or brainstorming. But you must add the science. Never forget that. Create your academic digital presence. ORCID, Google Scholar, LinkedIn profile with publications and talks. You can have a social presence with your Facebook account or your Instagram account. But these profiles will help you with your academic growth. Having done all these, plan for your future growth. Once you near the end of your residency or immediately after you've finished your residency, identify academic fellowships in microsurgery, craniofacial, hand, or burns, whichever field you're interested in, both in India and abroad. Choose centers known for education innovation, not just surgical volume, and apply early. Many fellowships need applications 6 to 12 months ahead. I know of great surgeons who applied for fellowships in microsurgery but ended becoming aesthetic surgeons. Your interests may change, but it is important that you take up a fellowship, follow it. It will guide you towards your ultimate passion. And in the course of all this, maintain a balance. You are important not only to your family but to the country and to our specialty. Academia can be intense. Protect your clinical skill. Your credibility as a teacher depends on it. Protect your mental health. Take breaks. Avoid burnout. And most importantly, protect your personal relationships. They sustain you through life. So, when you choose an academic career in plastic surgery or any other medical field for that matter, the clinical work that you do will keep you human. The teaching that you do as a part of your work will keep you grounded, and the research that you do will keep you evolving day upon day. Ultimately, it's your life, and your satisfaction at the end of the day is the most important. All the best.